Hello, hi. My name is Temitope Shemranjo. In this short video, I'm going to be demonstrating the non-parental medication administration. To start with that, I have here printed out my physician order and my medication order. This will help me to compare if what the physician has put down is what is documented in the medical record. So I'm going to be doing the comparison of the two tabularized information. Then I'm going to be verifying my cis rights. So to start with, I'm going to be doing this, looking at the medication record, the physician order. In the physician order, I have the name of the patient to be Buzajak, which is well written, Buzajak. The MR number 8713465 8713565 in the medication record, correct. Date of birth 06/2019, so it's correctly documented. Alien long, which will be the provider, is well written. For the medication, I have the date stated. That's 2020 Sevaclo 500 milligram PQ4R for infection 8:30 a.m. from the physician, which is also documented in the medication record. For the physician, 8:30 a.m. for the second medication, Synthroid 100 mcg/pqam, Synthroid 100 mcg/pqam, correctly stated. And for the third, Nitro B 2% ultimate tropical QAM, 1 inch on the patient's chest, which is correctly documented. Nitro B 2% tropical QAM at 8:30 p.m. 1 p. So the medication record was duly signed that the person that entered the information, while the physician others two was duly signed. Then allergies, known allergies detected, which is also stated on the medication record, which is good. To verify my cis right, which are the right to the patient, right to medication, right to dose, right to time, right to route, and right to documentation. So I've confirmed that. Then I'll be having to do 3 checks. So in performing the 3 checks, I'll start by doing my first check, which is pulling out my medication from the drawer. So when you pull out medication from the drawer, and I have to confirm the dosage for the appropriate dose, I will have to go through the book. So and I will look for the side effect. So I will going through the medication book. I'll be using my nursing drug preference book. So from what the doctor has ordered and from what I have as the pulled out medication with the medication record, I have the Sevaclo, I have the Synthroid, and I have the Nitrobid. So going over the medication book for the Synthroid, for the Sevaclo, to start with Sevaclo, for the generic name is cephalosporin, generic name. The dosage is PO 250, between 250 to 500 mg for an adult, and my ordered medication order here is 500 milligram PQ4R for infection. Oh wow, that's on the high side, but I know there must be a reason why the provider has stated that. I'm going to ask her with that information later. Then the uses, it's an antibiotic that is used for the treatment of bacterial infections such as pneumonia. And then talking about the side effects, when you administer it on the patient, those are the things you should watch out for: is dizziness, diarrhea, stomach upset, headache, vomiting. So those are the side effects for Sevaclo. So anytime you administer it on any patient, watch out for those symptoms. Then going to the next one, which is Synthroid. The Synthroid, the generic name is levothyroxine. Then it is used to provide more thyroid hormone. The dosage is adult less than 50 is PO 16 microgram per day. Oh, okay. And the side effect: sweating, headache, nausea, fever, and hot flasher. Then the anxiety and insomnia. So looking at this from the medication order and the physician order. It says, okay, it's the age range and the information you have here. The patient still fall within the dosage, so it's okay with what is we have here. Then for the nitro bead, for the nitro bead, classification is, the group generic name is nitroglycine. It's a rectal ointment, and it's used to, the action is to decrease preload and afterload, which are responsible for decreasing left ventricle end diastolic pressure. It is used to treat chronic stable angina pectoris, paralysis, or angina pain. And then to administer it, it says you should be measured on a paper supply. Use paper to spread on non-airy area of chest, abdomen, thigh, skin, thin layer, spread over 2 to 3 inches. Do not rub. Oh, this says we should spread over 2 to 3 inches, but in my order it says 1 inch on patient's chest. I know there must be a reason for that too. Anyway, I'm going to ask the provider why that is so, which is fine. So for that is for my first check. Now going to my second check, I'm going to take off my hand glove. I'm going to perform hand hygiene, and I'll be measuring my medication. I'll be measuring it, but before I do that, I have to calculate what I have and compare it with what is ordered. From what I have here, I have 250 milligram 5 ml of Sevaclo, but my doctor ordered 500 milligram. Therefore, I'll be having half over ordered. According to the knowledge of dosage calculation, we have X over 500, which is ordered, with the availability of this is 5 ml over 250. Therefore, S equals to 2500 ml divided by 250. S gives us 10 ml. So with this, I have 10 ml to be given for the Sevaclo. Then I will go straight to measure 10 ml. I'll make sure my hand is clean. Perform hand hygiene again and make sure my hands are clean. Then I'll sit my cup on the table. Then I'll have to measure the 10 ml. In the past, I used to do it this way, but I learned a new thing in the class here. So you have to open the lid. After opening the lid, while your cup is seated, you have to go down looking at 10 ml so that you can be able to see what you are pouring. You will look at it from the bottom so I won't avoid any mistake. Good job. Okay, with this I have 10 ml. So I now measure 10 ml into the cup. So that is that for my second check, and I'll be doing my third check. But in doing my third check, I'm going to my patient's room. So I'll pick all these, all my medication, and I'll get into my patient's room. Now, to start my third check at my patient's room, I'm going to introduce myself. I'll verify the name. I'll talk to my patient. Hello, Miss Buzojak. Hi, how are you? My name is Temitope Shebanjo. I'm a student nurse from Mountain View College, Dallas, Texas. Can you please verify your first and last name for me? Oh, good. Can you please verify your date of birth? In course of doing that, I'm looking at her wrist. Okay, good. Thank you, Miss Buzojak. Today I'm here to administer your medication, but before we do that, I'm going to provide privacy in the room. Then I'll perform my hand hygiene. Then I will explain the procedure of what we're going to do. So, Miss Buzojak, here is your Sevaclo for the treatment of infection. Then we have your Synthroid Then I have your Nitro B, which is an ointment. I'm going to put this one on your chest. For your Sevaclor and your Synthroid, you're going to swallow that in your mouth. Please, I want you to be comfortably placed. Please, may I be allowed to adjust your bed? I will adjust the bed. I'll put down the rail right here because I need to give her something. Then I'll make sure she raises her head up. I don't want her to be sleeping while I'll be giving her pill for her to be comfortable. Miss Buzajak, please lift your head up. Are you comfortable now? Please, can you open your mouth? I will open the Synthroid. I'll put it in the cup and I'll give in my mouth and I'll give her water. Good. Can you swallow that? Good. Thank you. And for the Sevaclor, can you please open your mouth? Thank you. Is an ointment. Does that taste good? Fine. Do you want some water to wash it down? Good. Thank you. Then the last medication I have to administer onto you is your NitroBead. For this NitroBead, I'm going to measure on the measuring paper. The prescription says 1 inch. So I'm going to open the lid and I'll measure 1 inch. So I won't measure. Please, in a little bit, I'm going to pull down your clothes to avoid constriction. Then I'm going to place this on her chest. So please do not rub the paper. Just leave it on. Allow it to take effect on your skin. So, Miss Jack, while I'm putting your bed down, I'm placing your head in the normal shape. Are you okay? Are you comfortable? Please, do you have any issue of concern? Do you want to tell me anything? Do you feel good? Okay, I'm going to remove my hand glove. I'm going to perform my hand hygiene. Please, I'm going to place your bell by your bedside in case you need anything. Feel free to call me. I'll be stepping out. I'll be either in the next room or by the computer right there. Please feel free to reach out to me. I promise you I'll be here. Thank you, Miss Buzager. Then I'll put all these used ones in the appropriate place, like in the trash. I'm going to be verbalizing the next steps, which is sublingual medication. In administering sublingual medication, you have to put it right under the tongue. When you put it right under the tongue, you allow it to dissolve naturally. I'm going to educate my patient not to swallow, not to drink water, not to chew, not to eat while taking sublingual medication. You leave it there and you allow it to dissolve. Same thing goes with the buccal. The buccal is in between the gum and the cheek. You place the medication in between the gum and the cheek. So you allow it also to dissolve naturally. You don't eat, you don't drink. Please, you don't drink water, you don't swallow it, and you don't chew. Allow it to dissolve naturally. Then, the next stage, then I'll perform hand hygiene, put on my glove. Then, the next thing is instilling high drop. I'm going to explain to my patient, in instilling high drop, you may experience some burning sensation, but then I will start by telling my patient that. Then I perform my hand hygiene. I'll hold the cotton bud on the lower lid of the eye, on the lower eyelid. Then I'll ask my patient to look at the ceiling. Then I will hold the dropper above the conjunctivitis sac. Then I will instill the prescribed drugs. Then after that, I will apply some pressure to the nasolacriminal duct. I will ask my patient to close her eyes gently. Then in case I want to apply ointment, I will apply it evenly. I will ask her to close her eyes too. Then in case I need to add any patch, and I will do that. So I'll perform hand hygiene again. I will put on my glove. Then to hair drop. For the hair drop, I'm going to warm the medication in my hand for under the normal room temperature. For an adult, I'm going to pull the pinna. I'm going to pull it up and backward. Then I will instill the prescribed drug in the hair. Then I will have my patient to stay side laying for just 5 minutes. So I'll perform hand hygiene. I'll put on my glove. For the nasal, I will ask my patient to breathe through the nose. Then I will hold the dropper above her nose. Then I will instill the prescribed drug. Then I want my patient to remain in a supine position with the head tilted back for just 5 minutes. So that is that for the nasal drop. I'll wash my hand again. I'll perform hand hygiene. So I'll be going to the next stage, which is applying patch. How do you apply a patch on a patient? Like you have to take it stage by stage. You know, some of these, especially the elderly people, you have to be careful with their skin. You have to carefully remove, after you have performed hand hygiene and you are putting on a new glove, you have to carefully remove the old patch and drop it in the biohazard bin. When you drop it, you have to wash off the residue area. You wash it off with your hand glove on you. When you wash it off, the next thing is you have to remove your glove and perform hand hygiene. Then you now put on another glove. So you have to now place a new patch on the patient. Before you place the new patch, please note you have to write the date, the time, so that the next person coming in will know when to remove the patch. You put your date, the time, and your initials on the patch. Then you gently place it on non-hairy parts of the patient. Place it on you locate a non-hairy part, and that is where you place the patch. In case of ointment at bedside, you have to apply the prescribed number on the paper like we did with my patient in a room the other time. We have to measure it on the paper, then apply it on the skin non-hairy parts. So that is that for that. So, and like I warned my patient, you have to tell your patient, do not rub. You have to leave it for effect to take place. So you have to perform hand hygiene again. Then you are going to the last stage, which is enema. In order for you to perform an enema on the bedside, on the bed, you have to make sure within you have access to the toilet. You have to make sure you have a commode or there is a bedpan closer to you. And on the bed, you have to be very, very careful. You have to make sure you have a waterproof pad placed on the bed where your patient is sitting. The two rails on the bed, make sure the left rail is up while the right rail may be down, and the bed is adjusted to your working level for you. Make sure the patient is laying laying towards the left side. Then you have to locate the buttocks where you're going to administer the enema. But before doing that, I'm just taking this one example for enema. You have to make sure you lubricate 3 to 4 cm of the tip of the rectal tube, so before you insert it into the anus. So you have to make sure you're careful. You have to separate the buttock, and you slowly insert towards the umbilicus. When you do that, you have to leave it. You remove the tubulin carefully. Then you can cover with a paper towel. I have this here. You can cover it this way with a paper towel. Some people discard it immediately, while some people will just keep it. Maybe they'll still have to use it again in case the patient is not going. But if the patient is going, you discard it. You don't need to keep it. You can, some patients, it depends, like 15 to 5 to 15 minutes they will go. But make sure the commode is very close to them and they can have access to the bathroom. Then after you remove the tubulin, and you have to provide a perineal care in case, then you have to perform hand hygiene. Thank you.